In the human body, a delicate and complex cascade begins when a cell experiences damage, which is the starting point for the production of potent mediators of inflammation. This image vividly and charmingly illustrates the metabolic breakdown of a 20-carbon polyunsaturated fatty acid, known as arachidonic acid, which is normally found sequestered within the structure of cell membrane phospholipids. The journey begins with the initial catalytic release of this arachidonic acid by the specific enzyme phospholipase A2. This enzyme is highly sensitive to and activated by various inflammatory stimuli, such as cytokine signals, mechanical trauma, and even microbial products, which thus initiates the classic and critical inflammatory response pathway. At this very first and crucial biochemical junction, pharmacologic intervention is possible, and glucocorticoids, which are powerful corticosteroids, work to inhibit the action of phospholipase A2 directly, effectively shutting down the entire biochemical pathway and leading to potent anti-inflammatory effects that are fundamental in the treatment of systemic autoimmune disorders. Once arachidonic acid is liberated from the membrane, it must enter the vast metabolic landscape and travels down one of two major and divergent pathways. A significant concept is the arachidonic shift, which occurs primarily when the main cyclooxygenase enzyme is therapeutically blocked, usually by specific non-steroidal anti-inflammatory drugs, or when a cell is under metabolic stress, which can lead to the shunting of arachidonic acid to the alternative lipoxygenase enzyme pathway instead of the conventional metabolic route. This shift can be a major factor in various medical reactions, for example causing aspirin-exacerbated respiratory disease, where the blocking of cyclooxygenase inadvertently leads to a dramatic increase in the production of leukotrienes from the unblocked lipoxygenase pathway, which then causes severe and symptomatic bronchoconstriction. The primary metabolic route is often depicted as the main road, where arachidonic acid encounters the cyclooxygenase enzyme, also universally known in clinical settings as cyclooxygenase 2, which is critical for converting it into prostaglandin precursors, like prostaglandin H2. These precursors are then rapidly converted into numerous active prostaglandin and thromboxane subtypes. One of these critical products is prostacyclin, also known specifically as prostaglandin I2, which is synthesized predominantly by the cells of the vascular endothelium. Prostacyclin is an excellent vasodilating agent and is famously known for potent antiplatelet effects because it effectively and strongly inhibits platelet aggregation.